Hi guys, good morning. Sorry about the delay. We had some technical issue with YouTube. Welcome to another AMA session. I'm Dr. Behnam, founder and board of dermatologist, founder of Happy Head. And today you're joining us for another AMA session. So let me pull up all my questions for you guys. Today is May 14th, and we're excited to be here. And again, if you have any questions, you could definitely send them in via the chat on YouTube or basically on Instagram as well. So, just as a reminder and full disclosure, I want to remind you that this information for educational purposes only and is not meant to provide medical advice or service. Please do not rely on this information to make medical decisions. And remember to discuss the risks and benefits of any treatment with your medical doctor before starting treatment. And this does not establish a doctor patient relationship. So we're going to go to the questions. So how does finasteride affect women's hormones? That's a very good question. So finasteride is a testosterone blocker, which means that finasteride inhibits the enzyme that's responsible for taking testosterone and convert to DHT. It works the same way in both males and females. So it's affecting both women and males the same way. You're reducing your DHT level. The only difference is that in males, sometimes the finasteride could also have risk of sexual side effects by affecting that DHT level, whereas in females, it may not. So, but it really works the same way. We do not use typically finasteride in females less than age 50 because finasteride is a category X and you should not get pregnant on it. So we take an additional caution and we don't give it to females below age 50 that might get pregnant. Um, but otherwise, if you're a woman above age 50, you could use finasteride. That is not a problem as long as you do not live with someone who is pregnant. What is spironolactone? Spironolactone is an FDA-approved blood pressure medication, which means it is used to control patients' high blood pressure. It's a diuretic, which means it's going to make you pee more, and that's how it controls the blood pressure. Traditionally, spironolactone has been used in female pattern hair loss. And the way it works is that uh, it is a testosterone analog, which means it competes to bind to the same receptor as testosterone. And by doing so, it blocks testosterone from binding and kind of prevents the the effects of testosterone. So it kind of has very similar effects to finasteride, but just works differently. In the US, spironolactone is mainly used in females and not in guys. Spironolactone could have some side effects, including lowering your blood pressure, as well as causing some hormonal issues like breast tenderness and irregular periods. And look, it may work for some females, it may not work for some other females. It is used off label for hair loss in females and also for adult hormonal acne. How does spironolactone affect women's bodies? So what happens, it could cause irregular periods, which means that you might have some bleeding between your periods, or some patients may feel that they have more than once a month. Some females really don't like it. It might also cause breast tenderness. It might also elevate your potassium level in your body, which means you have to avoid eating bananas, drinking coconut water, and obviously do not get pregnant on it. And for spironolactone to be effective, it really has to be like around 100 milligrams a day. There are some patients that may do spironolactone and finasteride if you're above age 50. I mean, everyone's different. But you could certainly mix spironolactone with other medications out there. Can topical minoxidil only be just as effective? It depends. There are many different concentrations of topical minoxidil. The over-the-counter ones is 2% or 5%, and the prescription ones are 6% and 8%, or higher. Usually, the over-the-counter topical minoxidil is not as effective as the prescription topical minoxidil or the oral minoxidil. But this is usually a first thing to use. So if you're like a brand new patient to a hair loss field and you try to do something, topical minoxidil may be a first choice. Should I be worried about shedding during the summer months? Usually, patients do not, usually the hair cycle is such that patients do not shed that much during the summer months. And I always make the joke that during summer months, you're probably going to have your strongest hair. whereas patients tend to shed during fall. That's why they call it fall. You know. So usually you're gonna have patients. They go through the cycle of hair shedding during the fall period. So you're gonna have your worst hair or like thinnest hair more like around November, December time. Is it normal to experience shedding while starting Happy products? So Happy product contains three different ingredients: finasteride, monoxide, and retinoic acid. The monoxide can cause some hair shedding initially. That's true with the over the counter, and also that is true with the prescription ones. It mainly happens mainly with the topical minoxidil, but sometimes could also happen with the oral minoxidil as well. Usually the shedding lasts about 6 to 8 weeks initially, but let's say if you're using the product either oral or topical and the shedding extends beyond 3 months, I would probably reach out to your doctor and come up with a different game plan. Is spironolactone available on your website? Yes, it is. You're talking the topical oral. The top, yes, the topical, and I believe even the oral spironolactone, they're both available on our website. I believe that actually Happy is slowly phasing out the topical spironolactone because unfortunately it has a very strong smell to it. So, and a lot of patients just don't appreciate it. But the oral spironolactone is definitely available for sure. Yeah, oral is there. And in fact, we have the oral combined as a super capsule, which is the oral spironolactone combined with oral minoxidil combined with vitamin D. So you're basically taking three ingredients all in one. So one capsule does it all. Will I experience shedding again if I switch from topical minoxidil to oral minoxidil with no break? Usually not, but it may happen. But usually not. I also have patients that were on the topical over-the-counter solution minoxidil and they switched to the foam version of minoxidil and they went through shedding again. So again, those are unusual, but things could happen. What is the longest I can go without treatment before I can start to lose my progress? So that's a very good question. Everybody basically the treatment varies for everyone. Um, Usually, if you're on the oral medication, it could take anywhere from 3 to 6 months for you to basically regress. But it may be sooner for some patients, and everyone's different. I did skip over a question here. Does the effect of minoxidil ever plateau? Yes. The effect of anything could plateau. Finasteride, minoxidil, and this is why we like to combine things because I truly believe that when you combine things, the risk of plateau is less. What is tadalafil? Tadalafil is the generic for Cialis, and what it does is that it is used to combat the effects of potential sexual side effects from the oral finasteride. Can I combine it with another medication? Yes, you be happy. It does have a combined medication of tadalafil combined with um, finasteride and vitamin D on our website. What is the ideal daily hair care routine? Oh, that's a really good question. So basically, you get up. So if you're using a topical solution, basically you want to apply the topical on and let it dry, and then you could apply your gel or whatever else you want. At night, you could basically do the same thing again. You could basically take a shower first and then apply the topical on top. And if you have a derma roller, you take the 0.25 millimeter depth derma roller and gently roll basically on the scalp to push in the topical product. If you're using the oral medications or the oral super capsule, you just take one capsule a day, every day at whatever time you want. Um, how often should I be brushing my hair? That's a very good question. I mean, as long as your brush is loose enough, but you're not really pulling a lot of your hair, you can brush every day. I mean, that's not a problem. What we usually recommend is that you have to take it easy with your hair. So things that you don't want to do is that you don't want to be too aggressive with the hair. You don't want to have your blow dryer basically on like super high heat. I mean, those things are not very good. Um, what is whey protein concentrate and why is it good for hair? So, if you look at whey protein, there are two versions of whey protein. There's the concentrate and there's the isolate. What the isolate is that they isolate certain type of amino acids such as leucine, isoleucine, valine, and they put them in much higher concentrations. And the reason why they do this is because those amino acids are good for muscle building. So, like a lot of people that want to build muscles, they want the higher dose of those amino acids. But the problem is that those amino acids will also increase your testosterone production, will lead directly to testosterone production. So this is why the isolate is not highly recommended, because that could increase more testosterone production. So the concentrate, it's the exact opposite of isolate. They have not increased the concentration of certain amino acids really high. So it's a safer whey protein type. So we like whey protein concentrate for hair as opposed to whey protein isolate. Also, you could do organic or vegan protein. Those are all good as well. What medication would you recommend for a female getting a hair transplant to maintain optimal results and prevent further hair loss? That's a great question. It really depends upon your age. If you're above age 50, you could do oral finasteride or oral minoxidil, or you could even do the topical finasteride and minoxidil. Obviously, not immediately after hair transplant, but like maybe a month or 6 weeks after transplant. If you're a female below age 50, we do not use oral finasteride because since it's a category X. So you can do oral minoxidil or oral spironolactone. I'm a big fan of oral minoxidil, and I think it could really help out a lot. So, usually my first choice is oral minoxidil in females below age 50. And usually, if you're someone above age 50 and you don't have any history of breast cancer, I would do oral finasteride. Um, does hair dye hurt your hair when you already thinning? Yes, it could. So I mean, it also depends on the hair dye and what's in it and what color it is. But but I always say going lighter is bad. Going darker, it's not as bad. And the reason is, I mean, if you ever highlighted your hair, I mean, as guys, we don't highlight our hair. So, it took a while for really me to really sit down and explore the process and understand it. But the hair dyeing process, to lighten your hair, you have to use products that have a lot of benzoyl peroxide. And those benzoyl peroxide basically are the ones that will strip the color off your hair. And you have to do it multiple times. So people that are really blonde hair, basically, they have to dye their hair basically multiple times. And it's that benzoyl peroxide stripping the pigment that damages your hair. So if you go darker, it's not as bad, but going lighter is like really bad. So I tell my patients, do not go light, don't get highlights because that could really like damage your hair. So yeah, so you have to, and also some patients also have reactions to some of the ingredients in the dye. So a lot of things could happen that could damage basically your hair follicles. How often should I be? We talk about the brushing. What are in the hair growth supplements? Do I really need to take 4 a day? That's a great question. So the hair growth supplements are this. It has vitamin D, iron, pre and probiotics, keratin, collagen. The reason why you have to take 4 days because in order to get the good amount of collagen in there, we had to basically put a lot. It takes many capsules to kind of get the good amount of collagen to your body. That's why they recommend 4 a day. But honestly, I'll tell you, I have patients that take 2 a day and they're perfectly fine. But the hair growth supplements are really important because you need your vitamin D, you need your iron, you need your basic other natural basic vitamins. Those are really key. How do I know if my hair is starting to thin? Well, great question. There are a couple ways. First of all, taking photos is really the most standard way. Number two is the number of hair sheddings you have. How much hair are you losing on a daily basis? I mean, if you're losing 15, 20 hairs a day, it's not a big deal. But if you're losing like 100 hairs a day, that's a big deal. And also, it's like the thickness of your ponytail. I mean, if your ponytail was this thick a year ago and now it's this thin, well, obviously you're losing your hair. So those are some of the things basically that that will help you see if you're losing your hair or not. And also, there's some patients that really don't shed, but they miniaturize, which means the hair follicle just thins out and gets smaller, and that's how you lose your hair, but you're not shedding at all. Um, what are the different types of male pattern hair loss? So male pattern hair loss goes through. I mean, there are many different categories. It's called the Norwood scale. So some patients may just lose basically the frontal scalp area, the widow's area, that might just go back, and some patients may start basically in the crown and they're gonna lose it there. Um, and yeah, so those are really like the two most common patterns, and it kind of starts from there and kind of expands out. So like there's some patients that in the front they look great, but they just lose the crown, and there's some patient that in the front it just starts to go back. Again, the key is to be proactive about the hair loss. So the sooner you start the treatment, the better it's going to be. And the reason is because remember, your hair is miniaturizing, which means it's getting smaller and smaller and smaller. So if once it passes beyond a certain point, you cannot bring that hair back anymore. So what you want to do is that you want to treat it as is miniaturizing, so you reverse that miniaturization, and it is possible and it could be done. But if you wait too long and the hair passes beyond that certain level of miniaturization, then that hair is considered dead. And usually the oral and topical medications won't help you, and transplants the only thing that may help you. Can I use Happy Head after my hair transplant? Yes, you could, but I would probably wait a month before you do it, and definitely do not derma roll for probably 2 months actually. Again, how long should I wait? It's about a month, and is oral or topical better? Well, if you're on oral, you could use it right away. So so let's say if you did a transplant, you could start the oral right away. For topical, we're waiting a month to 6 weeks is probably the best. Guys, these are great questions. I'm really happy you guys are asking these questions. So what makes Happy Head unique is because we customize. So our entire philosophy at Happy Head is that we understand that every individual person is unique, and the hair loss is also unique. So we're here to customize your formula. We don't believe that one size fits all. So when you come to us and basically you want a prescription grade hair product, based upon your past medical history, your social history, your hair loss history, the way your hair looks, we customize the formula just for you. And let's say we send you a product and for some reason it's causing too much irritation, there's some issues. What we're going to do is that you could let us know, and let's say you're having some reaction to some of the ingredients. We'll take that ingredient out, make your fresh bottle just for you, and ship it out to you. Um, we can also lower the concentration of certain ingredients just for you, or increase it just for you. We have board certified dermatologists on our team. These are doctors that went through special training for many years, basically on hair, skin, and nail. So they know your hair well. And we just don't have like nurses just writing the prescriptions compared to our competitors. So we have board certified dermatologists. We understand hair loss. All we do is hair, we don't do anything else, and we'll customize the product just for you. Again, what makes Happy Head unique is we're board certified dermatologists. We're founded by dermatologists. We customize the product just for you. And we have ingredients that our competitors don't have. Like we have dutasteride, which works in clinical studies. It's been shown to work much better than oral finasteride, and we combine a lot of stuff together. So there's a lot of perks that Happy Head that our competitors don't have. How does the sign up process work? It's really easy. It takes like less than 5 minutes. Just go on our website, answer a short medical questionnaire. It may require you to upload some photos, or sometimes maybe not. It depends upon the questionnaire. And then that information gets sent to a dermatologist, that they review your medical questionnaire, and they customize the formula and basically write the prescription and ship it out to you. How does one change the formula? It's really easy. You just go to happyhead.com/help, and you just tell them, look, I have an issue with my formula. Can I switch it out? And we switch it out for free. We won't charge you. We'll just make a new bottle and ship it out to you. I'm going to go back to one of our questions from before. My ponytail got thinner over time after menopause. What do you suggest I try first? So menopause is a very common reason that we see that's a cause of hair loss. So again, you have two options: either try the topical or oral. I mean, in my opinion, I think the oral sometimes may be easier, especially for females. So I would try the oral, and I would probably go on the oral finasteride minoxidil mix, and that could help quite a bit. So, and as you're doing the initial sign up process, you could say, look, I'd like to try the oral, but also you could also see what your doctor says, based upon your medical history and how much you have lost your hair. They could also suggest something for you, but I think the oral is a good way to start it. Can I use a minoxidil formula after using the Happy Head derma roller? Yes, you could. Yes, or you could use the Happy Head topical formula too. But yes, product alert, liposomal. So what is a liposomal formula? Liposomal formula, it's a very special formula that prevents the absorption of the finasteride into your bloodstream, as a result reducing the side effects. But other benefits of liposomal is that, one, it's not a solution, so it doesn't drop on your face. And number two, it's only once a day. It comes in a pump, you just squeeze it out. It's kind of like a lotion. You apply it to your scalp once a day, not a solution, doesn't drip. easy to use, doesn't make your hair greasy or anything. So we're very excited about it. You can order liposomal on our website. And basically, it's for both males and females above age 50. So it's all males and females above age 50. Is the happiest first to market liposomal formula. We were the first one that got it right, because most liposomal formulas, they only have finasteride and they don't have minoxidil, but we were able to kind of tweak the formula and come up with a finasteride minoxidil combination mix that's more of a cream lotion that you just apply to your scalp once a day. It doesn't spill on your face and not greasy. Again, what makes us better? I mean, again, multiple ingredients in one. Now, what is the super capsule? Super capsule is a combination of multiple different ingredients in one. Happy was the first nationwide distributor of super capsules in the US. And we have multiple different super capsules. We have the finasteride, minoxidil, vitamin D all combined together. And what the benefit is that instead of taking three different capsules, just take one and you're done. Our other version of super capsules do dutasteride, minoxidil, vitamin D, and our third version is spironolactone, minoxidil, vitamin D. Why would I recommend this product? One, it's easy to take because just take one capsule and you're done. Number two, you could combine it with topical. So if you're already using topical, we've noticed that patient that take the oral, you get this synergistic results. It's called sandwiching, and you get better results. The way you place an order, if you're already a happy customer, you just go to our website and say, I'd like to add a super capsule. Or if you are new to Happy Ed, just go on basically new patient form and basically fill that out. Again, about Happy Ed, Happy Ed is a subscription service, which means that we auto ship the product to you. And the reason is because to see best results, consistency is key. So we want you to be consistent. That's why it's on auto ship. You can also do a lot of self-serve online on our account page. Once you've placed an order, you could pause it, skip a month, and we also have our help desk at happyed.com/help. And basically, you could do a lot of things online. We are here to cater to you. Remember, Happy Ed assigns board certified dermatologists through a HIPAA secured doctor patient chat. They could talk to the doctor. We also have a team of just hair specialists at your disposal they could talk to. So just go to our help desk and you could start chatting with one of our hair specialists at any time. Again, guys, thank you so much for tuning in to another Happy at AMA session. We really do appreciate if you could leave us a review on our business, Better Business Bureau page, BBB page, or Trustpilot. We really appreciate it. And again, thank you so much to our team, Genevieve and Francesca, who make all this stuff happen. And if there's any questions, please feel free to reach out to us. Again, Happy Ed, we're here to cater to you, to our patients. And if there's any questions, we're here to help you and answer those questions. Have a beautiful day. Thank you so much. Bye, guys.
Woohoo! That was good.